Hi, I'm Nancy, and I'm one of the co-owners of Odonata Care with Brenda Kazire. Brenda and I wrote the booklet, The Care Plan, A Path to Comfort for the Hospice Patient. Today, we're going to continue along with how to manage symptoms that arrive during the end of life. And this one specifically today we'll talk about is breathing issues. So right now, as we get started, I want you to take a really deep breath and hold your breath as I'm talking. I want you to think about what's happening and how do you feel as you're holding your breath. Are you thinking about your breathing? I always say to my patients, if you are thinking about your breathing, or if your loved one is talking about their breathing, there is something wrong. Breathing is automatic, right? We shouldn't have to think about it. It should be completely comfortable and really not anything that we are aware of. So what is our goal as we talk about this today? Our goal is that you will be able to provide symptom management, meaning actions that you can take, medications that will relieve discomfort and do it quickly. So our goal is to have no discomfort or air hunger as we're breathing. And if you can't breathe, you've probably let go of your breath by now. I imagine you might have been a little anxious. Think about the time when you jump into a pool or you dove in really deep into a lake and you were like, oh, I got to get that next breath. It is very anxiety provoking. It's very frightening if you can't get a breath. And that's what people are feeling when they're not breathing comfortably. Do know that pain can also cause both the anxiety, which will also feed into shortness of breath. So they can go hand in hand. I want to make it clear that during end of life, we expect that oxygen levels drop. It is dialed into our DNA that is one of the things that happens. It does not mean, though, I want to underline this, it does not mean that as that oxygen level drops, that the patient or yourself will be feeling any discomfort during that time. You won't feel short of breath. So when that normal number, 90 to 100 is normal, if it drops below 90, there is nothing wrong with the patient if they're not feeling any distress about that. So what's our rule? Number one, you look at the patient. Are they comfortable? Breathing comfortably, maybe sleeping, whatever it is, if they are comfortable and their O2, their oxygen level is low, it doesn't matter. Treat the patient, not the number. That's a rule that we use in all of hospice care. Look and listen to your client, and then if they're comfortable, believe it. You always believe what the patient looks like and what they tell you. Now, if you have looked at your patient or your loved one and they're breathing 22 to 24 or more a minute, they are working way too hard and you want to try to alleviate that. So first of all, have them stop any activity that they might be doing and take a rest. If I ran a mile or even a block perhaps, I'd be short of breath. For a patient who's ill or a person who's ill, maybe 5 or 10 steps can be quite exhausting and can cause shortness of breath, even getting in and out of bed. So again, expect that that's an exertion that may cause them to be short of breath. But as soon as they stop the activity and recover comfortably, then there's nothing you need to do about it. If they do not recover quickly and they look short of breath, what's the first thing that you can do? First thing you can do is adjust their position. Sit them up high with their back supported. If they're all crunched down in bed, pull them up so that their back is being supported so that their chest can open. You can lean them forward. Don't let them have their arms crossed over their body. Get their arms away so their chest has the full ability to expand in a natural way. If a patient is receiving a nebulizer treatment regularly or they just use it occasionally, it might be time to give them one. Make sure that you know how to operate that nebulizer so that if there's a reason to use it, you know how to set it up right away. If the patient is using oxygen, make sure that it's working correctly, that the machine is turned on, that there aren't any kinks, that it's in either the patient's nose or there's a mask in place, whatever you're using, but make sure that oxygen is functioning well. Now, do we add oxygen right away when someone's short of breath? No, it is an artificial support. And as we've said many, many times, our body knows how to die. It is in our DNA. We do not need artificial support necessarily. So we do not start oxygen when someone is short of breath initially. The very first thing we would do after getting them in a good position is to make sure that they have taken some medications, and your hospice team would have provided those meds. If they are a patient that has taken medications for breathing problems, make sure that they are taking their regular medicines on schedule. The goal is always to be the Girl Scout, be ahead of the problem, and try to prevent a crisis by doing the things that have worked in the past and doing it on a schedule. If you're going to use a medication, a lot of times a little bit on a schedule goes a lot longer. If you wait until there's a crisis, sometimes it takes quite a bit more medication to get on top of the symptom, and that's including breathing. So if you need to use an as-needed medication, do so. Don't wait. It will get on top of the symptom more rapidly. And if they're still short of breath in 20 to 30 minutes, you may need to repeat that medication according to your nurse's instructions, the doctor's orders. Don't be afraid to use what you need. If you are able to get the patient comfortable again, they're not looking short of breath, they're breathing 18 or less, and they look comfortable, believe it, you did a great job. So just go on with your day. But do take note what you did, what worked, and have that in mind in case it happens again. If you are not getting your patient comfortable, your loved one comfortable, and you have done all of the steps, take a deep breath yourself, but call your hospice team, your medical team, to get some further instruction so that your loved one, your patient, is not suffering with that anxiety and fear of being able to breathe comfortably. Thank you. Please go to our website, thecareplan.net, for our booklet and much more information. And also check out all our videos at our YouTube site, The Care Plan or Odonata Care. Thanks for your attention today, and breathe wonderfully and smoothly well.